Hi, I wanna talk about my experience in this class and what I learned in this class. One of my favorite chapters in the book of Dupre Communication About Health. It's chapter 8 because I think I'm gonna use it the most in my job. It's an end of life experience. I talk about hospice. I talk about palliative care. Um, for me, it's lots of new information, lots of new words. It's explaining how the patient adjusting his emotions, his mental status to um, learning new experience of ending his life, how he's spending his time with his family. Um, it's lots of new information for him, lots of new learning experience for the patient. For me, I work with lots of patients who I know they're gonna have an ending life, and they're gonna have lots of health issues. Another real good chapter in the book, it's chapter 10. What I'm gonna use the most, it's a crisis management. Crisis management chapter 10 is basically explaining what's going to happen sometimes to a health facility like a hospital, and what kind of crisis management have to be done, like crisis time management, um, what kind of policies, what kind of business presentations to media have to be provided. It's all new experience to me, lots of new information I learned in this class because um, so much stuff, so much information, and I try to be as a sponge, try to suck all the new information to learn the more I can, because when I use all this information, like chapter 5 talk about stress and talk about burnouts. I have lots of co-workers who experience burnouts, and some of them work for a couple years and they don't want to come back, and they don't want to work anymore in a hospital because they have so much stress and they burn out completely, and they want to work in different area like in a retail or someplace and don't have to deal with stressful patients or stressful situations when they treat the patient. It's all about health communication and business communication with the patients. Lots of new experience, like in chapter 4, talking about communication skills and satisfaction, about patient rights of informed consent. I know a little bit before, but it's in a chapter 4. I can explain more and more. So it was great experience to learn. In chapter 3, talking about therapeutic privileges, information released to patient, and talking about doorknob disclosure, something like doorknob disclosure, something I never know before. So it's all new experience, it's all new information, it's something I'm gonna use it in the future. In chapter 7, talking about Eastern and Western perspectives, different strategies, and different how every culture treats the patients. So it's all new information for me, and I know I'm gonna use it. And chapter 6, talking about diversity in healthcare and talking about healthcare literacy. I know before some information, but I never know a lot. And it's kind of explain about chapter 4 about gender difference between males and females, how they go to doctor appointments, how they get in sign up for the doctor appointments, and how they act at the doctor office, and how they fill the information, what kind of issues they have, what you're supposed to do to help them. Have to make sure they know all the information before they sign the consent form. It's only information. It's just great class. I want to thank you, Professor Lapper, to help me, to help other students, and it's a great class. It's so much information I'm planning to use for the future class, for the future job. Thank you so much.